Hi guys, welcome to my channel. Welcome to another video. Welcome to my channel. This is our Health of, where we talk about everything women's health, everything women's wellness, everything women's lifestyle. My name is Olakoyokwemi. I'm a physiotherapist here in Ibadan, Nigeria, and I'm very passionate about women's health. If this is your first time on the channel, you're welcome. Thank you for stopping by. If this is not, thank you so much, guys. Thank you so much for your comment. Thank you for your support. I'm really grateful. Welcome back to the channel. Today, I'll be talking about a very prevalent topic amongst women, talking about urinary incontinence. I'll be talking about why it is more prevalent in women than men and some of the predisposing factors that could make it more likely for a woman to come down with urinary incontinence. If it's something you're interested in listening to, please continue watching and subscribe to the channel. Thank you. Alright, so what is urinary incontinence? Urinary incontinence is the unintentional passage of urine. If you want to urinate, you would have to deliberately go to the bathroom, sit on the WC, and pass out urine. It is deliberate. Anything that changes this order of passing out of urine is termed as urinary incontinence. So it can come in different forms. Let's say you lick yourself while on your way to the WC, or let's say you bedwet, or let's say you'd rush to the toilet and then before you get there, urine is already leaking. So urinary incontinence can come in various forms, but if it's not deliberate passing out of urine, then it is considered to be urinary incontinence. About 50% of adult women have urinary incontinence as opposed to the 3 to 5% that have it in adult men. Why is it so common amongst women? Some might say it's because of poor hygiene, and as much as good hygiene is important and it helps to reduce our chances of getting infection, one of these causes is the length of our urethra. The urethra is a tube that attaches to the bladder. That is the tube through which the urine passes out. Now, in women, our urethra is quite short. The average urethra of a woman is about 4 centimeters, while for the men is about 20 centimeters. Because of this short length of our urethra, it is easier for infections to spread. So women are more prone to having UTIs, urinary tract infection, and urinary tract infection can then lead to urinary incontinence. Men do not usually have that because their urethra is long and then it passes outside and then they pass urine more easily, which is not the same for women. Another thing is fupa, or let's say fat around the abdominal region. Women have more because the distribution of fat in women is more towards the abdominal area. This fat will cause more pressure around the pelvic region, which can then predispose us to having urinary incontinence. So it's not just because of your poor hygiene, it's also because you are a woman and you are more prone to having urinary incontinence. However, there are things to be done. Also, because of the way urinary incontinence is and because of the society where we live in, women find it very embarrassing, they find it very weird to talk to other people about this condition. So most people suffer in silence. It's not supposed to be so. It's not because of what we do, sometimes just because of who we are. So let's learn to speak out and ask for help. If you have urinary incontinence, it is best that you visit your doctor. There are causes of urinary incontinence that can be more dangerous and you have to manage immediately. In this video, I'll be talking about natural causes. Urinary incontinence is not a disease condition in that sense. It is like a symptom. So urinary incontinence can be caused by a far more serious condition. So you need to check that with your doctor. But for acute urinary incontinence, that is what I'll be talking about in this video. For the purpose of this video, we'll be classifying urinary incontinence into 4. That's the stress incontinence, the urge incontinence, the overflow incontinence, and the mixed. That means you can have 1 or 2 types of incontinence at the same time. Now, for the stress incontinence does not have to do with stress. It is when the pressure in the bladder is too much to keep the urethra closed. Remember, the urethra is the tube through which the urine passes through. So for stress incontinence, the pressure is too much, and any further increase in the pressure around the abdominal region will just open the urethra. So when you have stress incontinence, you would feel like a leakage of urine when you cough, when you sneeze, when you play sports. So if this is kind of pattern you have, then you have stress incontinence. For urge incontinence, this is when you cannot defer the urge to use the toilet. So let's say you feel the urge to urinate now, and then within seconds you're already leaking urine. Like you cannot wait till you get to a proper decent place to pass out your urine before you start to leak out urine. So that means you cannot control it. So once you feel like urinating now, if you don't get to the toilet and the next 2 seconds it passes out, that is what we refer to as urge incontinence. Then we have the overflow incontinence. This is when the bladder is so full, but you cannot pass out a lot of urine per time. So let's say you use the toilet this minute, and in the next 5 minutes you feel like using the toilet again. So it's like the urine is just flowing out slowly, and then you feel the incessant need to go to the toilet. That is what we refer to as the overflow incontinence. And then the last one, which I said was the mixed incontinence. It's possible for a person to have both stress incontinence and urge incontinence. It's possible for you to have stress incontinence and also have overflow incontinence. So if you have two or more types of incontinence, we would say you have a mixed incontinence. So the next thing we'll talk about now is the cause. What causes urinary incontinence? Now, that will take us to anatomy. We have the bladder. The bladder is the organ that stores urine. Then we have the urethra, which is the tube through which the urine comes out. Now, this tube passes through a muscular structure at the floor of the pelvis, which is the pelvic floor muscles. The pelvic floor muscles are like a funnel-shaped musculature that is beneath the pelvis. The pelvic floor muscle is the muscle through which the urethra, the vagina, and the rectal opening passes through. So this muscle helps to negate the pressure that comes from the abdomen. So it acts like a support system. So if you're coughing, your when you cough, the abdominal pressure increases. What the pelvic floor muscle is supposed to do is to counteract this pressure, so that the urethra, the vagina, the rectal opening still remains shut. So it's like a counter pressure in that sense. But if the pelvic floor muscle is weak, if there is a lot of abdominal pressure, then the urethra is opened and not able to close, and that way urine can leak out. So one of the major cause of urinary incontinence is a weak pelvic floor muscle. When the pelvic floor muscles are weak, any slight increase in the abdominal pressure, the urethra is opened, and then urine flows out without your deliberate efforts. Another cause of urinary incontinence is the overactive bladder, when your bladder is overactive. And this can be caused by quite a number of things. It can be caused by anxiety, it can be caused by the use of certain kinds of drugs, and it can also be caused by some of the things that we take, some of the food that we eat. Another cause of urinary incontinence is the damage of the urethral sphincter. Because the urethra is a tube-like structure, there is a sphincter at the tip that works like a tap. So once the sphincter relaxes, urine comes out. Once it contracts, then it is closed and urine cannot come out. But when this sphincter is damaged, then it won't know when to relax or when to contract, and then there is already a disruption in the flow of urine flow. So also another cause is the detrusor muscle. The detrusor muscle is the muscle in the bladder that affects the contraction and the relaxation of the bladder itself. So the bladder is where the urine is stored. The urethra is the tube through which it passes through, and the pelvic floor muscle is where the urethra passes through to the outside in that sense. So any abnormality in the bladder, in the urethra, in the pelvic floor muscle would lead to urinary incontinence. So, what are some of the predisposing factors that can make you more prone to having urinary incontinence? The first one is age. Although it's not like everybody that grows old has to have urinary incontinence, but the number of people that have urinary incontinence increases with increasing age. Also, if you have a family history of urinary incontinence, that makes you more prone to having urinary incontinence. Actually, there's nothing you can do about your age, there's nothing you can do about your family history, but there are some factors that we can do something about, and those are the ones I'll be talking about now. The first is obesity. Remember that one of the causes of urinary incontinence is increased pressure in the abdominal region. So what obesity does is that there's a lot of fat around the abdominal region. This increases the pressure of the abdominal area, the pelvic area, and if the pelvic floor muscles are not strong enough to counter this pressure, to lead to urinary incontinence. So if you're obese, if you're overweight, try as much as possible to reduce your weight to eat healthy. This would help to make you less prone to having urinary incontinence. Another thing is smoking. Now, for smoking, smokers have a higher chance or have a higher possibility of coughing. Coughing also increases the abdominal pressure. So when you have frequent coughs, you're increasing the pressure in the abdominal area, increasing the pressure around the bladder, and makes you more prone to having urinary incontinence. So try to stop smoking or reduce the amount of cigarettes you smoke per day. Another thing is constipation. Now, everything I've been saying has to do with pressure. If you're constipated, and let's say you have to use the toilet, there is a lot of groaning, grunting that you have to do. Those groanings, those gruntings increase the pressure around the abdominal region, weakens the pelvic floor muscles, and can predispose you to having urinary incontinence. So what can you do? Take fruits, take food that are high in vegetables, fibers, ensure that you're taking a lot of fluids, and this will help you pass out feces more easily and reduce your chance of having urinary incontinence. Another thing is caffeine. Caffeine is found in sodas, found in teas, found in coffees. What caffeine does is that it works like a diuretic. So that means it reduces the absorption of water back into the system. So once you take a lot of soda, if you take a lot of soda, if you take a lot of coffee, it will reduce the amount of water that your body would retain. So that means the bladder is easily filled up. So if the bladder is easily filled up, then urine comes out more frequently, and then the bladder is easily filled up. The pressure around the abdominal region is around the bladder is much, and then it will predispose you to urinary incontinence. So reduce your take of soda, reduce your take of coffee, take herbal teas instead, take a lot of fluid, a lot of water instead of soda. Another predisposing factor of urinary incontinence is UTI. So that means you have to get better with your hygiene around your urethra, around your vagina. Ensure that you're not putting things that are not supposed to be in there. So once you have good hygiene, you're eating healthy, you're exercising, and that will reduce your chance of having urinary incontinence. Next week, we'll talk more about the exercises that can be done if you already have urinary incontinence and what can be done. So if this is something you're interested in, please tune in next week and we'll have an interesting time. Thank you for watching. Bye.